All right, Dr. Verma, thanks for joining us today. How are you doing, my friend?
I'm doing well. How about yourself?
Doing fantastic.
Good.
So, just gave a little intro to you and some of your background, but I think the story always comes a little bit better out of your mouth. So, to give us a little origin story, kind of how'd you get to where you are now, and from med school residency at all?
Yeah. Well, I appreciate you having me on. It's always a great opportunity to talk about these kind of things and hopefully help inspire some other people out there. I'm born and raised in Ohio, Marion, Ohio, just about an hour north of Columbus. I went to undergrad at Ohio State University, and undergrad was a pre-med biology major. And as I was getting throughout my years at school, I'm like, what do I want to? What kind of medicine do I want to go to? Do I even want to go to medicine? The similar thoughts that a lot of people have, understanding, the stress and studying for MCATs at that time and how much time you're gonna be away from family and friends and all that stuff.
Mhm.
Um, so I actually did not even get into medical school my first round um, of interviews or anything. That was I don't even think I was waitlisted actually. So I was like, it took the extra year to spend some time. Fortunately, I graduated early from Ohio State because I had a bunch of credit hours loaded up from post-secondary classes, and I was able to use that time off to kind of screw some things up. I didn't get into any medical schools that I would have wanted to go to, and even the second time around. So I ended up opting for St. George's University. My limiting factor was actually my MCAT scores at that time. I had everything else on my resume looked fine, comparable to my colleagues. But my MCAT scores were average, you know, um, and it was specifically the English portion for what it's worth. I don't know. I know it's changed a lot since I took the MCATs, but it was a limiting factor, right? And then so I ended up going to St. George's University. That took me to Newcastle, England for a year, where I did pretty much the first year medical textbook stuff, not much clinical stuff, but really, really book heavy stuff. And then second year of med school, I went to St. George's University in Grenada that had their main campus, and I was down there for a year um, and getting more hands-on stuff, but also a lot of book work, clinical rotations in Brooklyn, New York. Uh, Hopping around from different hospitals in Brooklyn, New York, mainly with the NYU and Kingsborough Jewish Medical Center and Methodist Hospital. They've all kind of changed names now and gone through different organizations. But uh, what happened was my PGY 4 year, I was doing a PM&R elective, and I got along well with the residents. I got along well with the director and the program coordinator, and fortunately, I matched there for my residency. Did my intern year in Michigan, came back to Brooklyn, and ended up having a really good time and really took advantage of what I was learning in residency. I think that's a good place to pause because I think that's like one of the most important things. And I know we've discussed. I think I was towards my end of my residency when we started getting introduced to each other and that kind of stuff.
Yeah. Yeah. I mean, I think one of the, obviously as people go through residency, get exposed to so many different tools in every program. I know I was, have listened to you talk about before, the way that we get trained, specifically within PM&R, but I think every specialty is the same way. Where we get trained, the people we get trained with leads to so much of how we view the medical world, right? And the way that we're going to interact with our patients in the future, the way we think about specific things, and trying to make the most of all of those interactions and all of the great people that we can learn from, but also being open to understanding that there's likely more out there, more that we can learn, different people, different perspectives. I think I heard you say once, the different dogmas that are there to be able to,
Yeah.
because obviously medicine is different, and even PM&R residencies, your residency, I'm sure, was exponentially different than mine at UC Davis, right?
Yeah.
And,
Right.
and so being able to understand and learn those nuances, but then be able to find things that are interesting and helpful for the future career you're going to build, and ways that you're going to be able to kind of, I guess, direct where you're going to go afterwards.
Yeah, I totally agree. And I think that's a huge message. In all honesty, I wasn't thrilled about getting matched into Brooklyn. I wanted to move back to Ohio. I wanted to move back to my family, and I still have a lot of friends here. So I wasn't exactly thrilled, but it's kind of to your point. And I tell this all the time. I made the best opportunity of the situation I had.
Mm.
Um, so much involved that me and my colleague, we both had to become co-chiefs, that we were so involved from day one. Like, let's change the curriculum. Let's start doing this. Let's start doing that. Let's do didactics about this. Hey, let's go to anatomy lab. So we started really raising the bar because uh, back in the day, Kingsbrook was not a place that people wanted to go. Um, and I don't know if it is or not isn't, but at least the years that we spent there, we did absolutely awesome. We crushed it. We got to learn what we wanted to learn. We, you know, passed all the boards and all that stuff. So, at the end of the day, we got licensed, but we also had a really good time. We had a
Yeah.
good small group of friends. So,
Yeah. That's awesome.
yeah, yeah. And I encourage anyone out there is like, you go in a situation that you're not loving. It's like, okay, that's fine. So how do you make this better? How do you make it better for yourself? Can you propose things to the leadership? Um, are there different ways that different people like to learn? Do you get in small groups on the weekends or after work? Because ultimately after PGY 2 year, PM&R residency is not terrible. It gets, you have more time to do the things that you want to go specialize in, and I think that's what's important.
Yeah. Yeah. I mean, I think, I've had the perspective now of, having finished a little whiles ago and having walked a lot of medical students through the process of looking at the programs. I mean, I think one of the things that I've really kind of come to as the main thing for just about any program is, how open are the leadership to in taking feedback, right? At the end of the day, that might be
Yeah.
the most important thing for going into any residency. You get there, something's not quite right, or maybe you're just a little different than everybody else and you're looking for a specific type of education or a specific ability to test something out. How open is the leadership there to allow that curiosity to foster, because that'll help everybody to have just so much better careers.
Yeah. I think a lot of people get bogged down. Oh, this residency doesn't do a lot of procedures. This residency doesn't give us opportunity to do a lot of spine stuff. And I want to do spine or a lot of joint injections. Like, honestly, I thought the same way and I felt the same way.
Hmm.
But what we did is we practiced ultrasound on each other. We went back to the textbooks and studied how do you set up a fluoroscopy machine. Without us actually touching the needle, we're still able to do so much with our minds. So, by the time I got the fellowship, my fellowship director's like, go ahead. Like, what do you mean, go ahead? I don't know what I'm doing. But he's like, no, this like I'm going to teach you through this.
Yeah.
So this is what you do first. This is what you do second. So, okay. So then you build up competence over time. So people that get discouraged, like, oh, this residency isn't doing anything for me. It's like, you're missing some of the other things that you can be adding on top of it.
Yeah. So how did you decide on which fellowship you wanted to do?
So I was really adamant. Back in high school, I played football my freshman and sophomore year and started becoming really athletic and growing into my own and that kind of stuff. I went to smaller schools, so it's kind of easy to rise up to the upper tier of people there. But I wasn't the greatest, but I wasn't the worst. Starting defense and that kind of stuff. Well, I was sprinting down the field to down a punt, and I overextended my back, and my legs kind of gave out. My back didn't really hurt, but my legs gave out. Right, so I'm like trying to run to the sideline. Every time I try to sprint, like my legs just give out under me. Like, what's going on? So I had to walk to the sideline, got some treatment. Long story short, I ended up finding out that I had a pars defect that no one ever knew about, and um, ended up having to quit sports, rested, all that stuff. It's like, so I got really into rehabilitation medicine and kind of prehab and post-hab and stretching and strength training and all that stuff, and just that fitness kind of lifestyle. So I always thought I was going to go into sports medicine,
Mhm.
thinking that the only way to get to sports medicine was through family medicine or emergency medicine. Eventually, my roommate at the time said, "Hey, I'm doing this PM&R rotation at Kingsbrook. Why don't you join me? I think we'll have a lot of fun." So that really opened my eyes up. Fast forward a few years, I'm doing my PGY 3 year where I have more time for electives. I did one elective with the late Dr. Malenga, rest in peace. He opened my eyes up to another side of sports medicine with regenerative medicine and how we can treat patients and set patient-centered care and all this stuff, which was fantastic. And like, this is what I want to do. And then about 4 months later, 5 months later, I was doing another elective sports medicine rotation at a hospital in New York. And I'm going to clinic and I'm going to all these things like, gosh, this is just PM&R clinic. I don't know if I want to do another year of this. This is the same thing that I've been doing. And it's no offense to sports medicine doctors. They know way more about sports medicine stuff than I do. I just didn't want to do the sideline coverage. I didn't
Mm,
want to go to training rooms, and I know it's a vital portion of what they're learning and what they want to do, and that just wasn't for me.
mm.
So I ended up not applying for pain fellowships, but interventional sports and spine fellowships, popularized by North American Spine Society, and interviewed a bunch of places. Again, I interviewed at Cleveland Clinic, I interviewed in Michigan, I interviewed a other places, and ultimately I ended up luckily getting into Birmingham, Alabama, where my fellowship director is the one that says it's all about dogma. It's about the dogma you learn about what you want to do and how you treat patients. But fortunately, it was one of the best experiences of my life. I got a lot of procedures done. I got a lot of knowledge. I have great friends from that program and great resources that we can converse with. So that's how I ended up in this field.
Right on. Now, in fellowship, did you guys do a lot of regenerative, or is that mostly just the exposure with Dr. Malanga?
It was mainly just exposure with Dr. Malanga, and I kept up with it over the years during residency. I kind of kept things to read, went to a couple conferences, but we didn't do very much. They're actually, I believe, they're going into the regenerative medicine now, which would have been great, but it is what it is. It was really just to learn the techniques
Got it.
because you can't learn that stuff in a weekend course.
Yep. Yeah, no, I think the story that you tell is kind of a very common story that, we hear from talking to people, and, particularly, like you said, PGY3 residents, and starting to look at, I know I want more training. I know I'm not going to get exactly what I need to go into the career that I want, but I'm not sure which direction. I always use exactly what you said, the sideline coverage and locker room. Like if that's what you want, you got to do sports, but if that's not what you want, there's a lot of ways to learn how to, stick a needle in a knee and a hip and learn the techniques that, that can help optimize all of the things for patients. And so, yeah, thankfully, NAS, and I'm sure there's plenty of other places that are starting to look into,
Yeah.
being able to at least give some uniformity to the educational process, right? I mean, there was plenty of the unaccredited fellowships for a while that before NAS came along and started to accredit some of the non-ACGME programs. But a lot of different ways to learn and to work with people that have been doing it for a long time. I mean, I think one of the most interesting things about you is that, going through all of this, learning all of these things, and then, we get to, the real world. And mind you, by the time you're finishing fellowship, the real world's kind of a different world than the real world that I came into in, 2016. But you decided to open up your own practice,
Yeah.
which is kind of
Yeah.
crazy.
Yeah. Yeah. We definitely go through that and we'll talk about some pros and cons about that for sure. Essentially, what happened was I'm sitting there at my fellowship, knowing that I want to go back to Ohio. I want to spend time with my family, spend time with my parents, be closer to them. I haven't lived in Ohio for 9 years at this point, so it's like I got to get back, right? 9+ years. Um, wow, if you think about it, it's almost 12 years. So yeah, I want to go back, and um, I applied for a job in Columbus. I'm like, great, this is gonna be perfect. So I interviewed them before my fellowship. They said, we'll fly you up when we're more serious about contract negotiations. Flew me back up for the weekend, talked to them. I was like, listen, you know, that's great, but pay and all that stuff, fine. They send a contract over. I review it with my bosses or my mentor, uh, fellowship director and the assistant fellowship director. So we kind of looked at it separately, and I'm like, all right, listen. And I asked a lot of friends in the PM&R field, pain management field. So I said, like, all right, I want to change some things. I wasn't asking for money. I wasn't asking for more time off. I wasn't really asking for anything like that. I just said, these are some changes I'd like to see in my contract.
Mm.
They came back and said, yeah, no, we're not doing any of that. The contract is what it is, and that's just how we go.
Hmm.
I said, okay. And I guess that's the end of that conversation. So I never went back. About 6 months later, they call me again and say, hey, we want to come back up. We'll talk to you. So I go back up and said, yeah, let's have a discussion again. It's like, okay, we need you. We want you. Great. All right. Can I do things like Vertiflex? Can I do things like Intercept? Can I do things like spinal cord stim and all this stuff? And they're like, no, yeah, no, we have surgeons. We don't really need you to do those kind of things.
Hmm.
So I'm like, so you just want me to do epidural after epidural and medial branch block, even though we have all these other things? It's like, yeah, pretty much. It's like, And then the by then the money did not make sense, right? When you look at RVUs and all that stuff, that's a whole nother topic. So I came back down to Birmingham. I asked my bosses, sit down with them, said, if you were to start this all over again, what would you do? And I asked that to about 15 or 20 people, and that have made it in the world. And like all of them, except for one, said I would have started my own thing.
Hmm.
I was like, if everyone keeps saying this, I'm like, there's got to be something there. So I had late night with my dad and my brother sitting around a fireplace and just talking. And they're like, why don't you still run your own thing? So that was kind of like the green light, like just go get it. You don't have to prove anything to anyone. You just go do it. So that's kind of how I did it. And that's kind of how I ended up where I am. And it was a slow process. It still is a slow process. I'm not nearly anywhere I need to be. Thankfully, I'm just starting to become a little bit profitable month to month, which is always hard in the first year, 2 years, 3 years, up to 5 years even. So I did some locums to help bridge the gap, which was very helpful. And yeah, now I'm just trying to build up a patient population and deliver the care, deliver my own dogma out there.
Oh, that's amazing. I mean, and it's definitely not a common path, right? I mean, I think there's many of us and many people that are coming out of training. Look at the big hospital systems. Look at the big private practices in the area that are that have been well established. And for better or worse, a lot of people just kind of accept that the first job may not be everything. Maybe you won't be able to get to
Yeah.
do the things that you want to do, and you either get in and open the door a little bit more each day or each time that you prove yourself and try to hope eventually things change, or maybe move on to a different position after that. But to actually have the balls to actually just say, what, I know what I want, and I think that I want to just take the time to actually create the practice that I actually want to build. It's
Yeah.
pretty wild.
Yeah. No, I appreciate that. And yeah, it was a challenge I didn't want to back away from, especially like this. And here comes with, the disclaimer is, I'm fortunate that I have good family structure. Um, Fortunate in my eyes, but maybe not other people. I don't have any kids. I don't have any mortgages. I don't have a lot of student loans. Half my Ohio State as a state college was paid for,
Hmm.
so I don't have any undergrad loans. It was really just med school loans. I didn't go into more and more debt into residency and fellowship. I just kind of lived under my means. Still living under my means. Um, Again, don't have any kids. Definitely cost me a relationship that I made the choice that like, listen, I need to go grow this practice and do my thing. And it cost me someone that I love very dearly. Um, and it's not that it was bad terms and she completely understood. But those are the sacrifices I was willing to take. And I'm not asking anyone to do that. I would urge people not to do that. I know
Hmm.
people get married in residency or fellowship and have kids and have houses. Take care of your family first. That's probably what's most important. My mindset right now is I don't want kids, I don't want to get married, and I don't want to have a house. That might change, and that's fine. But I just like my mindset isn't definitely the one everyone needs to follow. Sometimes that $300,000, $400,000 a year looks really good.
Yeah. So, I mean, as you're deciding to do this and you start, actually trying to lay the groundwork for it, like walk me through like the very beginning stages. I mean, obviously there's plenty of technical things and I don't want to necessarily make this a very technical kind of discussion, but I mean, as you're just, thinking about things like finding a space, figuring out, what part of town you're going to be in, how you're going to start interacting with people who are referring, maybe reaching out directly to the community and figuring out how to create a name where people can, if it's that kind of a market where people can directly refer themselves to you. Like walk me through some of that.
Yeah. Yeah, I'll just start from the beginning. The first thing is, getting a business name, applying for a business license in that state, setting up bank accounts, just the groundwork, right? And then you're like, okay, where can I plop down? And to your point, you need to find a real estate property. Are you going to find something that's you're going to rent or buy? Do you need to take a loan or not? I was fortunate I didn't have to take a big loan out for this, so now I can still take more loans if I need to because I didn't take $500,000 from the beginning. Um, and that's what my friend had done. But regardless, so I decided I'm going to rent and finding a place. You don't want to be right next to another pain place. If you're in pain practice, if you want to do sports medicine, you don't want to be right next door.
Mhm.
You want to be in a part of town that's easy to get to. Obviously, the space you want to make look nice. I still haven't decorated my apartment or my office too much, but it doesn't look like it's just a hole in the wall. We did renovations of the whole thing. So all these things matter. I'm trying to look at from the patient's perspective a lot. Like if I was to come in, if my mom was here, what would experience for them look like? So that's the way I look at everything. Getting the phone systems, getting internet, getting an EHR, all these take time. Then the most important portion of your first year is getting in contract with the payers.
Mhm.
And this is a very tedious task where you're just submitting the same information over and over again, just in different ways to 8, 12, 20 different people and different companies. And then they'll come back and say, no, we're not giving any more contracts out. Or they'll say, here's our contract, it is what it is, which is significantly lower than what you would get your friend down the street's getting, or what someone's been in practice for more than 3 or 4 years is getting. So you take a major, massive hit at the beginning. And then filling up the office with furniture, exam beds. If you're going to do pain procedures, are you going to get a fluoroscopy machine and a fluoroscopy table? Are you doing ultrasound procedures? Are you good with the butterfly, or are you going to spend the $30,000-$40,000 for something a little bit nicer? And all these go into play, and you're weighing your pros and cons, pluses and minuses. And then the biggest step after that is, who am I going to hire first? That first person you hire has to be with you, kind of ride or die, needs to understand your flow, has to work well with you, because that's the person that's going to start training the next person. And you can train the next person, train the next person. And then ultimately that person elevates himself to a higher role in the office, because now they have all these responsibilities and these skills that you've bestowed upon them. So that's just the baseline, I think. And then community relations is huge. Going out to doctors' offices, I communicate with my reps all the time. Are there any doctors you can introduce me to?
Mhm.
Sure, they might not do it right away, but over time, I've gone to more and more events and meet people. And if you're personable and have a good time with them and show them that what your care model is, most will respond really positively.
Yeah, no, I mean, I think it's wild because I mean, obviously, those are things. Anytime someone's going into private practice at all, right? All of those steps happen. It's always just fascinating, like to have to take on all of that yourself, right? I mean, we're
Yeah,
we're a a decent sized group practice at this point. We have 8 physicians. We're bringing on 2 fellows this coming summer. When they come on, all that's going to happen. They're just not going to be aware of any of it, right? Like
yeah,
we have a process of being able to do that. But to have to think about all of that when you're still a baby doctor, right? Like you're coming out of fellowship, you're still trying to get your feet under you and really trying to figure out who you are as a physician. Cause I mean, I think all of us know that those first couple of years, when there's not somebody necessarily looking over your shoulder, you really hone the skills, hone that ability to be able to, of who you're actually going to turn into as an actual doctor.
exactly. No, I mean, just I don't know if you remember your first procedure that you were doing, like really by yourself, without the fellowship, without anybody else to, and you're like, does that look right? And I save all my films and stuff, and I go back and review it. If I'm like, does that, and I'll send it to my friends in my fellowship group. I'm like, is this right? This doesn't look right. He's like, you're fine. You're just overthinking. Okay,
Yeah.
just go
Yeah.
back to what you know. Go back to what you learn. Trust if you're doing something wrong, you know when to bail. So,
Yeah.
but yeah, I mean, even now, there's something weird that happens. I'm like, why did that happen? And I'm sitting here studying the images. There might not be an answer, but that's the reality when you don't have that cushion. And then it's not only that, everything can go wrong. Anything can go wrong in my office, and I'm the one to blame at the end of the day.
Yeah. Yeah. Well, now walk me through how you've kind of thought about some of the advanced procedures. I mean, obviously you brought up, some of them before and, wanting to have access to them, but, as somebody who's, starting your own thing, just walk me through how you're kind of bringing that into the fold kind of as an independent provider, starting something fresh in the community.
Yeah, it was one, just having access to procedures that other people don't do. So that's a big benefit because the hospital systems here are going to take 2 to 3 years just to approve some of these procedures.
Mhm.
And we'll use the interspinal spacers as an example because they've been around for a while. Um, the hospitals don't really want to prove it so quickly because of all these reasons, bureaucracy, compliance, and all that stuff. So a lot of the surgery centers are like, no, that's fine as long as you're skilled enough to do it. Show us a certificate of training. Show us that you're competent. And the way I see it, most of the time is it's just another tool in my toolbox. Most of the time, I'm not fixing your actual problem. I'm providing a temporary relief. You may still need surgery at the end of the day. You may need a bit more massive surgery, or the surgeon is like, "Nah, you're not ready for a surgery. You're just not that bad. Come back in 6 months." Well, they're still in pain, so you want to
Mhm.
offer something else. And now we're seeing a lot more changes. Like we'll just give the example of like the basal vertebral nerve ablation because you can see that on MRI, and that's a non-surgical thing. So what are we supposed to do with these patients? Just we'll just keep doing injections that aren't working because your discogenic or your vertebrogenic pain is causing the problem. So it's just good when you have another tool in your toolbox to look at and be like, this is something I can provide for you. Because we know that good patient care is worth its weight in gold because they're going to tell their friends and family, you don't need surgery. He has another solution for you. And I might not always have the solution. I think we know that. I think you got to be realistic with your limitations.
Mhm.
There's a patient the other day. I'm like, I've done everything I can, even with the interspinal spacer. I think you need to go talk to a surgeon. If he says come back to me, I will try more for sure. But that's kind of how it goes.
Yeah, no, I mean, I think that's, and that having that perspective, I think is really helpful. I mean, obviously not for just for you as a practitioner, but giving that, being able to educate the patients the right way with that, really helps. And, and hopefully, I mean, as obviously we're kind of talking a lot about this as as a, fascinating thing of starting your own practice, right? I mean, I would hope that because the hospital systems don't have it, theoretically, I guess a lot of the people that work within those systems probably don't have access to it. It might open up a little bit more doors where, as you're talking to the primary care doctor, you're like, oh yeah, well, yeah, not only do we do, epidurals and radiofrequency ablation, but we have all of these different tools that are available to these patients where, if they're indicated, they can be, very helpful for them.
Exactly. And I think that's the biggest thing is you have to get your training. You have to be educated. This is one of my big peeves in the industry, not as the industry, but these doctors, they follow them and they just say every patient gets this. It wasn't indicated. And this is why we say it's not indicated because look at what the mess that you've created because of this. So it's about being realistic with the goals and what your patient's goals are too.
Yeah. So what does your practice look like now? Are you still moonlighting, doing some locums, or is it you got your practice and that's your kind of full thing at this point?
Yeah, so the practice is pretty much full attention now. I'll do some chart reviews. I'll do some medleo cases, but nothing that is it doesn't cover everything, right? That's
Mhm.
just kind of extra cash. But yeah, I've gotten up to seeing about 8 to 12 patients a day and getting about 8 to 15 procedures a week as well. So it's not like we're bringing in the bacon, let's go. It's hey, we're sustaining, we're keeping the lights on. I'm not overdoing any of my bills. I'm not in debt anywhere. Um, the loans I'm going to be able to pay off in the next couple months, on a monthly. So it's good. It's kind of at that stage where the more focus I put in this practice, it's just going to grow exponentially.
Right on. And how many team members do you have at this point?
I have a front desk in my Columbus office. I could still go to Marion once a week. I have a good referral network up there, just growing up there. I have an MA that works there with me. And then outside of that, I've kind of sent my billing to this company in Florida. They do a great job and really hands-on with all my patients. That they will get on the phone with the patient and fix it. They do prior authorizations for me too. They do a lot of practice management stuff too. So really, it's just us right now, which is great.
Nice.
um, I'm ready to expand. I'm getting to that point where I need to be spending more time with patients and procedures than doing back office stuff.
Yeah.
So yeah, I'm looking for kind of an office manager that can kind of do more around the office too.
Very cool. Yeah, no, it's man, it's pretty amazing. I will say, I mean, being able to handle not only, learning how to fly on your own as a physician, but also, figuring out though everything in business, like all at the same time. Like legitimately, kudos to you. I think it's
I
such a
appreciate it.
fascinating story, and it's awesome that things are to the point now where everything seems like it's really starting to pick up steam and really heading in the right direction.
Yeah, no, I really do appreciate that. I think it makes a lot of people in out there like, oh man, if this guy can do it, almost anyone can do it, and everyone can do it. There's nothing really holding you back. You just have to think what your priorities are. I've lost a lot of hair. I have a lot more gray hairs than I did when I started this process, but it's all right. And it's not always great, right? It's every 3 to 4 weeks, sorry, 3 to 4 months, you hit a really, really painful stress point. And that stress point can last anywhere from 1 to 4 weeks until you get past that. You've kind of plateaued. You're like, and I was thinking, like, well, why am I doing this? This is stupid. I should have just gone the safe route, done this. But undoubtedly, every time I felt like that for that amount of time, on the other end, I'm like, oh my gosh, this is why I'm doing it. And it's always that one patient, right, that comes back to you and tears in their eyes, and they're like, thank you so much for what you do and how you do it. Because all those other doctors wrote me off. No one else wanted to help me out. Everyone else just says there's nothing that can be done. And I appreciate those compliments, but it's really what gets me up. It's what gets us coming back every day to do this, to be able to spend that time and do something meaningful.
Yeah. Yeah. And I mean, I think that goes kind of across the board for all things in, spine and pain medicine, right? I mean, I get a lot of I have anesthesia interns that rotate with me when I'm at the VA. And it's always interesting because, a lot of them, they're at that point of their careers where they chose anesthesia because they don't, some of them are like, oh, well, I like some procedural things, but I don't really like a lot of the patient interactions. And then obviously some of it, you have very certain patients that are the kind of the classic pain management patient, that they're like, yeah, this is really why I don't like patient care. And then they spend some time. We do some of the things that we're capable of doing, and you can see, a reaction like you said, where all of a sudden there's this patient that just has this amazing thing, and it's like this is it, right? This is why obviously we're trying our best with every single patient, but the some of the responses are going to make up for the ones that are lacking in what we're trying to provide for them, right?
Yeah, absolutely. Totally agree.
Awesome, man. Well, let's kind of start wrapping up. Let's leave people with maybe one vote of advice. Our average listener is med student, maybe early resident, kind of thinking about a lot of different things, obviously trying to get the medicine right, trying to understand the different pathways for getting the education they need. But obviously in the back of their head somewhere is their long-term goals of how they want to practice medicine, how, what setting they want to do it in, what they want their actual, future practice to look like. What's one thing that you would kind of tell to yourself when you were, so somewhere between an MS3 and a PGY2, trying to, work through it and trying to understand your future?
I think the biggest thing, especially in that time frame, because there's so much uncertainty about yourself and about where you fit in this world exactly. And that's okay. I think there's nothing you need to do about it. And if that just means waking up every day and going through the motions, and learning what you need to learn, pass the next test, if you allow yourself to get into what you really enjoy and what you're passionate about and what can get you up in the morning and all that stuff, is it will find you just as much as you find it.
Mm.
So you just have to let yourself open that opportunity and don't beat yourself up right now because you don't know. It's okay to change things down the road too. Maybe tomorrow I want to do something else. And will I say my practice was a failure because I want to do something else tomorrow? No. It's just I changed my heart and passion, what gets me up in the morning.
Yeah.
So I think it's really important, especially at that time. Don't be so hard on yourself. It gets better each and every year after really day one of med school. Every year gets better, better, and better. Um, yeah.
Awesome, man. Well, I appreciate it. I appreciate you spending time with us and kind of letting everybody know about your story and hopefully inspiring a lot of people. You want to let everyone know where they can find you if anyone has questions or wants to reach out?
Absolutely. You can find me on Twitter and Instagram. My taglines is DRNV Sports Spine. Um, I also have a YouTube channel called Things I Didn't Learn in Med School. I kind of go through the process of building your own practice. I talk about some other things, a little bit more practical things. A little bit, I get really heated in that sometimes because it's usually something that maybe upset during the week, um, and I kind of talk about it. Otherwise, my practice name is Essential Sports and Spine Solutions. You can look me up online, and I'm on LinkedIn. So if anyone has any questions, comments, concerns, whatever, you can feel free to reach out to me, and happy to help out in any way I can.
Awesome, man. Well, we appreciate it, and thank you all for listening. If you've made it this far, send a quick note to Dr. Verma, saying thanks for giving all the education. All right, and we'll talk to you guys next week.
All right, thanks everyone.